Hi, everybody. My name is Aaron Garman. I'm the medical director of Coal Country Community Health Center here in Beulah, North Dakota. I've been asked to address some of the myths, misperceptions, and confusion surrounding coronavirus and also the coronavirus vaccine. Today's topic, or this topic for this presentation, is where did influenza go? We hear a lot about influenza, and everybody should get their annual flu shot, and hopefully you do. But then there are those people who say, well, we got this coronavirus pandemic and influenza disappeared. Where did it go? It's one of the common questions that I get from people. And hopefully I can give you some answers, although I don't know that there's great proof to some of this data. It's some of it's speculation, but I think some of it's pretty good medical speculation. So first of all, if you look, the southern hemisphere and the northern hemisphere are two different influenza planes, for lack of a better term. When it's summer here, it's winter there. And so we see the influenza season first down there, and then we get it up here. And we tend to track that and see if influenza is bad in the southern hemisphere, then we're anticipating a bad influenza season in the northern hemisphere, excuse me. Well, last year we didn't have a bad influenza season in the southern hemisphere, and we didn't have a bad influenza season, thankfully, in the northern hemisphere. So the question still circulates, where did influenza go? First, was it just a down year? Did influenza just have a off year where we didn't have a lot of cases? We've had that before, but to this degree, it was pretty suppressed. We didn't see hardly any cases. I think I had one case of influenza this past year in my practice. Second thought is, with people, because of the COVID pandemic, with people socially distancing, with them washing their hands, with them wearing masks, perhaps that decreased transmission of the virus, which, if it works for coronavirus, it should help with influenza as well. So I think that had some effect. Also, people weren't traveling as much. We, shut down airlines. There were public transportation shut down, so you're not seeing as many people intermingling, and therefore reducing spread through that. Schools were also affected, where we had kids out of school. Children are the predominant driver for influenza spread across the board. Has been every year, probably will be every year. COVID was more young adults to 20 to 49-year-old people were spreading COVID primarily, and not so much kids, but influenza was primarily spread with children, or is primarily spread with kids. So if we keep them out of schools, maybe we decreased it because of that. Not advocating for no schools. I think schools are great. I think we need to keep them up and running, and I think we need to keep kids in school, but perhaps that's one explanation for why we didn't see as many infections. And then there's something called viral interference. Viral interference suggests that if you have one virus that's dominant, perhaps it protects you, for lack of a better word, against getting another viral infection. And perhaps this is like nature, where the biggest gorilla in the room can suppress the other gorillas. And maybe that's what was happening with coronavirus. It was the bigger, badder gorilla, and it was suppressing influenza, which isn't as severe a virus. We see this somewhat with variants, where you get one variant of the virus or one mutation of the virus that becomes more dominant and it spreads faster. The other variants seem to go away because they're less dominant viruses. And perhaps the same thing was happening with coronavirus. So these are all postulated theories. I don't have hard factual data to support any of those. I think they're all interesting ideas. I don't know that anybody is really doing the work to say this is what absolutely happened, because I think there are a myriad of possibilities, and it probably will never be able to be teased out as to what the absolute answer was. But I suspect that if you put all of those things together, that's probably why we had less or no influenza this past year. As far as testing goes, the test for influenza and the test for coronavirus are two totally different tests. So when people say, "Oh, you tested me for influenza and it came up coronavirus," that doesn't happen. It can't happen. It's not the same test. So no is the response to that. It's a specific test for coronavirus, not for influenza. And influenza testing is specific for influenza, not for coronavirus. So take that as you will. And if you have any other questions, please submit them to our website or to our Facebook page. And thank you for watching.